confidence that your procedure is going to be ran smoothly. Because when you're in the hands of professional doctors and nurses, you have your full trust in them and you assume everything's going to be just fine, and you should always have that thought. However, even in most procedures, doctors and nurses can make a mistake or even a fatal mistake on you or someone that you love, and that mistake can be avoided. These mistakes I'm talking about are medical errors. Medical errors is like a prime example of medical error. I was watching an ABC News clip yesterday, and it was on a passing event like a couple years back on a couple that had triplets. And hours after the operation, one of the triplets went numb and turned purple. And it turned out that the IVs of the mother and the infant were switched, and the infant received morphine, which was intended for the mother. And that's what I mean by medical error. Like doctors and nurses or whoever's facilitating the procedure that's to be done on you, they make a mistake. That's medical error. And I'm saying this speech today because this is a concern that largely goes unnoticed by a lot of people. I honestly have no idea that this is that prevalent. A couple statistics I can lay out here for you guys. Medical errors account for 98,000 deaths in the U.S. every year, and that would make it the 6th leading cause of death in America. I had no idea about that. Another statistic from the ABC News clip that I saw on YouTube was that 1 in 3 hospitalist patients will face a medical error during a hospital stay. So you actually probably face a medical error. It didn't affect you significantly. Did you see that you noticed it? But bottom line, we rely on medications, doctors, and hospitals as our last option for medical aid. To ensure that we receive the most efficient treatment, it is imperative that we use certain preventable methods to avoid medical mistakes. First and foremost, we should become more involved in our health care. New health policies and all these changes can be pretty confusing, and it's pretty crucial that we keep up to date with that. And just general advice, it's important that we follow simple instructions on our pills. If you have a certain condition, that might refrain you from taking certain medications. I know me personally, I have asthma, and that stops me from taking that, limits the medications that I can take. Also, in addition to that, uninvolved patients are less likely to accept medication from a doctor. Do not rely on routines that you think that work, so what you heard is good for you. More often than not, the doctors will provide you medication that is better than what you can offer yourself. So listen to what the doctor says. Going off that, take your medication constantly pretty seriously. Don't blow off the doctor. Actually ask questions, because this is your life that's in danger, and it'd be in your best interest if you ask questions to make sure you're in the best shape. With regards to hospital stays, if you have a choice, choose a hospital that has experience with dealing with your condition. It's self-explanatory. If you admit yourself into a hospital that has experience with your condition, more likely results are going to be better off than a hospital that doesn't have experience with your condition. Another thing, this might be an awkward question to ask, but please don't be afraid to ask doctors and nurses if they wash their hands. It seems like a question that shouldn't be asked at all, because they're professional, they should know that. They need to keep a sanitary environment. They advocate for that, so they should follow the rules. But that's also one of the main causes of medical errors is bacteria infections. So please ask if doctors and nurses have washed their hands. And after leaving the hospital, ask your doctor to thoroughly explain the treatment afterwards. This goes along with the reading your medication and pills instructions thoroughly. Make sure you know exactly what to do once you leave the hospital. Ask the doctor if you can go back to your normal routine and all the advice you should do. Take that back. Just get all the information you should know before after your surgery and your routine at the hospital or whatever. Lastly, with regards to surgery, make sure that your doctor and surgeon all agree on what's being done and where the surgery is being done. Wrong site surgery is rare, but once is too often. And if you don't know what wrong site surgery is, that's if you were going to get surgery on your right arm, surgery was actually done on your left arm, and you push that up, that obviously puts you in a worse condition, and that happens pretty often. And know your surgeon's experience, just like with hospital stays. If your surgeon has experience with your condition, then you'll feel more comfortable about the outcome of your procedure. But overall, hopefully I brought attention to a concern that largely goes unnoticed, because I know myself before this, I had no idea this even happens this often. And I hope I prove to you how imperative it is for us to use certain preventable methods to avoid these medical mistakes. Do what it takes so that you or a loved one will become an victim.